Okay, so if there are no questions, then we will continue from where we had stopped. So a quick revision of what we had discussed. Okay, so what was Carbo Veg all about? Huh? Yeah, it is all about collapse. It is also about stasis. We are talking about stagnation. The circulation, okay. There is venous stasis. Venous stasis itself will give us to a lot of problems. We will try to take one by one. Okay. Apart from stasis, apart from collapse. Trials of flatulent remedy, absolutely right. Yes, never well since an acute illness. After a prolonged illness, if you see a patient coming back to you and he says, sir, I am not well since then, one remedy you can think of is Carbo Veg. Good. Anything else? Slowness, sluggishness is a carbon. Yeah, it needs to be fanned from close distance. Okay, ear hunger, good. Desire salt. Okay, ailments from salt. Eating spoiled fish, overeating, alcohol, loss of fluids. This is hemorrhagic remedy. Very good. Okay. See now, the next topic that we are going to discuss, see, animation is not done. Anyway, see, we'll just look at this. The agenda for today's classes will be mainly focusing on the particular symptoms. We did discuss the mind symptoms of Carbo Veg. Okay? And what did I tell you on the mind? Just see, keep the generalities of carbons in your mind. What we saw is a very timid constitution. Reserved. Anger is expressed in throwing sarcastic comments. They give sarcastic comments. Okay. What else? Weak memory, and we also saw in the end that they are very indifferent. Indifferent to family, indifferent to people who have offended them. Okay. So basically in syphilitic Carbo Veg, we see more of indifference coming in. Okay, clear? So this is where we had stopped. Now we will focus on a very important topic, and this topic is particular symptoms. Probably the boringest part of materia medica. Okay, now what is this particular symptoms? Now I have been giving you this particular formula time and again. I have been trying to tell you particulars can be made interesting. Okay, or to study particulars we have a very simple formula, and what is that formula is, remember the sphere of action, remember the pathogenesis. That is the first step, and second step is what the ailments are, and the third step is, as a third year student you should know the application of miasm in materia medica. Okay, so understanding miasm or having a knowledge of miasm will again tell us where exactly this particular remedy is indicated. I will give you some examples. We will try to understand with examples. And the last part here is understanding PQRS. Very, very important. Understanding PQRS. Done? So these are few things you need to remember. So pathogenesis, you are all very clear. So what is the sphere of action? Where do you see Carbo Veg acting? Mucous membrane, GA, circulation, respiratory system, inguinal glands or glands in general. Sorry, lymphatic glands and glands in general. Okay, so this is the first step. Please remember, and we'll apply it slowly. And second thing is, Carbo Veg had a lot of ailments. I'll not ask you. I know you all know about the ailments. So Carbo Veg also has a lot of ailments. Done. And the miasm, the predominant miasm, it is mainly psychosyphilitic. Okay, psychosyphilitic. Done. And the last area is, we saw a lot of things which are very, very characteristic in Carbo Veg. What were the PQRS symptoms? The first important thing was state of collapse. Then, and second thing we also saw was hemorrhages. Third, we saw desires, aversions, the character of discharges, offensive and active discharges. Okay, so we'll try to apply all these things under particulars. Okay, so unfortunately because of time shortage, the animation part is not done. So everything is exposed. Okay. So before I expose the particular symptom, we are trying to go systematically from head to toe. And wherever we feel Carbo Veg is important, whichever area we see Carbo Veg has an affinity, we will try to discuss those areas in detail. Okay, from head to toe. Now before I start showing or exposing the slides, underhead, as a third year student, keeping these things in mind, where do you feel or what do you feel will be the action of Carbo Veg underhead? Very good. Okay. One thing is you expect headache. Possible. Good. Yeah, good. There is hair fall. Third simple thing that you can expect is, you can also expect, is a very good remedy acting on skin. So you can expect some eruptions on scalp. A better carbon acting on scalp is graphite. We saw in the previous class, we dedicated so much in graphites when it came to scalp. So here, more than the scalp, okay, more than the scalp, what you see is it can cause two very important things. One is headache and second thing is hair fall. Okay, so we'll go step by step and we'll try to understand what is the cause for hair fall, what is the character of hair fall, and which part of the head you have hair fall in Carbo Veg. I hope the headings are clear. Fine. First thing is, what causes hair fall? You all know the cause. So this is what ailments. See, the ailments that I gave you in the last class, they were general ailments. Okay. Now the ailments that we are discussing under head is a particular ailment. Out of those many ailments, okay, which is that ailment which has a capacity to cause head complaints in Carbo Veg or hair complaints in Carbo Veg? Okay, so after an acute illness, I gave you this situation. I have told you we have practically used this in a scenario which came after COVID. So we have cases, we had cases coming to our clinic after COVID. You know, husband complaining about wife, wife complaining about husband, the entire house is filled with hair. It's an exaggeration, but they see hair everywhere. Hair fall after COVID, or hair fall after typhoid, hair fall after a viral fever, or hair fall after an acute illness. You can think of Carbo Veg. Okay, then that's one very important thing. The second thing is, what is the character of hair fall? When I say character, what do you understand? See, in Carbo Veg, the hair fall is profuse. When I said you see it everywhere, it is profuse. Hair fall in handful. Like, you know, many times we have patients getting the hair in a cover, and they tell, sir, if this continues, by next visit I might go bald as well. Fine. So much of hair fall. Hair falling in handful. Okay. Other remedies for hair fall? Arnica, selenium, very good. Arnica, selenium, ignitia, then phosphoric acid, phosphorus, natrium, there are plenty of remedies. So in Carbo Veg, it has its own character. What is the character? Every case of hair fall, we can't think of Carbo Veg. Carbo Veg as a cause. After an acute illness, after a debilitating disease, if they have hair fall, you can think of Carbo Veg. One. And then we were also talking of profuse hair fall, and hair fall mainly from occiput. Okay, when you are looking at the anatomy, when you are looking at the area, hair fall more from occiput. There are people who have hair fall from vertex, hair fall from temple. It's a different remedy. Hair fall from vertex, very good, graphites. Two more remedies. I had put it in brackets in the last class. Yeah, girls are all looking in the, they're turning the pages. See, don't turn pages. It should be recorded. One simple remedy is lycopodium. The other remedy, the friend looked into a book and she's answering, is Vijaykrishna. They have hair fall mainly from vertex, and Carbo Veg has hair fall mainly from occiput. Okay. So this is the this is the first thing that we discussed. The second component under head was headache. From the ailments that we discussed, what can cause headache in Carbo Veg? Very good. Overheating. Only overheating. You also have overeating. Both the things. Getting overheated. We discussed the other remedies. Quickly, which are the other remedies? Bryonia, antimicrobe. Simple, to keep it simple. Bry antimicrobe. Okay. Ailments from getting overheated are ailments from overeating. So what is the type of headache in which we can think of Carbo Veg? After eating, if they have headache, or if they don't eat, they have headache. What is that headache called? It is called, very good, gastric headache. Good, gastric headache. So Carbo Veg can be a remedy for gastric headaches. Okay. Eating fatty food or overeating can bring in headache. So after delivery they can have hair fall, severe illness, stress. These are all the three causative factors in Carbo Veg, and profuse handful, you can see it here in the image, and headache mainly in the occiput. Okay. Hair fall mainly from the occiput. Headache from overeating, eating fat, headache of gastric origin. Okay. When I say gastric origin, the headache will be associated with eating. Okay. When I say stress headache, what do you understand? Headache related to stress. So when I am stressed, it is more. Okay. Fine. So gastric headaches. Any other remedies quickly as a third year student? Gastric headaches. Very good. Sulfur, anacardium. Good. Anacardium, sulfur. Those two remedies that we discussed can also be thought of in gastric headaches. Antimicrobe, bryonia. Okay. Of course, sulfur, anacardium and other remedies. Okay. So we'll go ahead, and unfortunately, I told you the animation is not done. So everything is wide open there, and it's not fun when it is wide open. That curiosity will be lost. Okay. So we are done with head. Okay. We'll slowly go to the ear. Under ear, there is something called as a gland here. Which is a gland? Parotid gland. So what is the condition? Mumps. Okay. I don't know if mumps is done in your medicine or in a pediatric. What is the complication of mumps? Huh? Okay. Your friend uses the word sterility, but I want to make it very simple. Arthritis or ophritis, which in turn might give rise to sterility. This is what we say metastasis. From mumps, the disease progresses into the testicles or into the ovaries. Okay. So this metastasis is what you get to see in Carbo Veg. Carbo Veg is not only indicated for mumps. It can be indicated when mumps gets complicated and when mumps metastasize into the ovaries or the testes. Okay. Am I clear? Per se for mumps, when you have kids coming with mumps, we have different remedies. In Carbo Veg, okay, mumps will metastasize into the testes or ovaries. Okay. So that is the first thing. Any other remedies you have in your mind? Metastasis to testes. So first very important thing is mumps, when it either goes into the testes or it can go into the ovaries. Arthritis or ophritis. As Madhusudan rightly said, when we have cases of sterility, this is one question we ask them. Okay, in your childhood did you have mumps? And after mumps, did you have a pain in your testicles or pain in the ovaries? Is a common question we ask in a case of infertility. Okay. So the other remedies are abrotinum, very important. You also have pulse, you have murk, you have restox. The situation is mumps, metastasis to mammae, testis or ovaries. Okay. So that's with what? Ear. Anything else in face that you can think of in Carbo Veg? How will be the face in Carbo Veg? The look of the face or the face in general? It will be pale and there will be cold sweat. Pale and cold sweat. Okay? Lips can be cyanosed. There can be blueness of the lips. Cyanosis or blueness of the lips. Okay? And nose, what do you expect? Very good. Epistaxis. Why epistaxis? Because it is a remedy which has hemorrhagic diathesis. So you have epistaxis, dark hemorrhages. Only dark? Very good. Passive. Yeah. Who was that? Slow. The bleeding is not gushing like belladonna. The bleeding is slow. Slow bleeding, you have epistaxis. Okay. Done. So these are few things you expect in in nose. What do you expect in mouth? You can answer. Go back to this thing, try to apply it. So one possibility is there can be bleeding gums. Very good. Or there is something called as pyorrhea. There can be pus in the gums, in the gingiva. There can be pus. Okay. Pyorrhea alveolaris is a condition. There can be bleeding gums. Okay. Bad breath. Naturally, pyorrhea, alveolaris and all those things. Hygiene gets affected and then there can be bad breath. Okay. Anything else that you can think of? Huh? Where? Ulcers, okay. Aphthous ulcers. No problem. See, it's a psychosyphilitic remedy. This is where the knowledge of miasm plays a very important role. Okay, you can see mouth ulcers. Okay. Anything beyond that? Lower down? Huh? We spoke of gum bleeding, we spoke of pyorrhea alveolaris, halitosis. You also spoke of mouth ulcers, possible. Okay. And GI proper, when you look at stomach, what is it that you see in Carbo Veg? Very good. It's a beautiful. I'm happy with that bird. I'm happy you are applying. What you see, first thing is they eat and there is issues with the digestion. Digestion is weak. Good. So what happens when the digestion is weak, when the digestion is slow? Don't go. Okay, see, don't immediately go down. Think what can happen in stomach. So when food is not getting digested, when food is staying in stomach for a longer time, so there can be bloating, there can be fullness, and there can be indigestion, because of which you will have eructations, belching. Okay, fine. Loud eructations, smelling bad, rancid, putrid eructations. These are all because of indigestion. Okay, there is no proper digestion, slow digestion. Okay, done. So what you see here is these are the headings under which we discuss the stomach symptoms of Carbo Veg. Okay. Now what are those headings under which we are discussing is, first thing is there is slow digestion. Okay. Because of slow digestion there is dyspepsia, indigestion, this giving rise to loud rancid eructations, there can be flatulence, there can be gas formation. So these are few things that can happen in stomach. Okay. Under stomach we can also keep two important headings in mind. What are those two important headings? You can write desires and aversions. A sure shot 5-mark question which will come up in your exams. Describe the gastric symptoms of Carbo Veg. So you start with mouth, then you will have to talk till anus. We'll go slow and we'll try to understand. Okay. So what you see here is indigestion, slow digestion, belching and all those things. Fullness, belching. What were the desires? Coffee, salt, citrus things. Yes, we had a picture of lemon. Good. Citrus, salt and coffee. What is that they don't like? What is the aversion they have? Aversion to milk. Milk, fatty food. meat, alcohol. Okay, those were the aversions. Okay, so this is what you will be writing under stomach. Anything else that you would like to describe under J? Huh? Okay, so this is a remedy for, we discussed this, trios, don't forget this point in your exams, in your life. Trios of flatulent remedy. Okay, and as your friend rightly said, Carbo Veg has an affinity for the upper abdomen. And they feel better by belching, burping. They feel better by burping. Carbo Veg. Trios of flatulent remedies. Clear? Okay. So, moving ahead, what else you see in abdomen? Think. Knowledge of anatomy. Which are all the other organs? Which are all the other organs? This particular remedy can have an affinity to. It can affect which organ? Liver. It can affect liver. Liver. Now why liver? Why liver? If you look at the ailments from, it has ailments from alcohol. Okay, ailments from fatty food. And you also have congestion. You also have venous congestion. You also have stasis, slowness. So what you also see is the liver in Carbo Veg is sluggish, which also adds to weak digestion. Everything will be sluggish. Okay. So the digestion is sluggish, the digestion is slow, the liver functioning can get slowed. So you see jaundice here. Okay. You see jaundice, hepatitis and cirrhosis, alcoholic cirrhosis. Fatty liver, your friend is telling and I am telling it loud. She is telling it in a low voice. I am just taking it from her and I am telling it loud. Good. Fatty liver. You can have cirrhosis, you can have jaundice, you can have hepatitis. Okay. Few things which are possible in Carbo Veg liver. Now if you look at the abdomen, what do you see in abdomen? What do you see in abdomen? Again there can be distension. Okay. The slightest food Carbo Veg is eating, it will turn into gas. This is how patient comes and tells you, sir, even the normal food, curd rice or rasam rice, whatever I am eating, it will turn into gas. The simplest food turns into gas. Okay. You have lycopodium, you have Carbo Veg, you have calicarb, you also have cinchona. Few remedies you need to remember when people give you such statements. Okay. Simple food turning into gas. Done. So distension of abdomen. Quickly, other remedies, when you see such picture, which are all the other remedies that should come to your mind? Lycopodium, very good. We also saw this in graphites. Okay. Yes? Bovista, a rare remedy. You have to remember. And you also have Carbo Veg. Want pant loose after eating. Okay. Antim crude. No issues. These are few remedies. Could be sulfur. Yes. Okay. So distension of abdomen, everything that he eats turns into gas. Excessive flatulence. Simplest food aggravates the suffering in abdomen. Okay. Done. Simplest food aggravates the suffering in abdomen. So these are few things. See, now very important is rectum. Okay. Now why rectum is important? Yes, very good. See, I know hemorrhoids, but before hemorrhoids, what was the expectation is, it is a remedy acting on the venous system. And naturally, you know, this is an area which has lot of veins. And hemorrhoids is nothing but? What is hemorrhoids? So, when the veins, they get distended or they get dilated, fine, then we call it as hemorrhoids. So, very important is, it is a remedy which has action on the veins. And naturally, the venous system, everything is slowed down. Okay? So, hemorrhoids is a very important indication of Carbo Veg. And when we were students, one favorite question that used to come up in Viva is, name the remedy which has white hemorrhoids. Okay, name the remedy which has white hemorrhoids, meaning the hemorrhoids, okay, might look pale. Then So the remedy is Carbo Veg. If you get the same examiner whom I got, if you are lucky, the question might be the same, and the question is name the remedy for white hemorrhoids. Okay, so as students we were not aware, but when we got to know, the remedy is Carbo Veg. Okay, so hemorrhoids which are blue, large, protruding, burning and white. Very important remedy for hemorrhoids. Okay. See, it can also cause diarrhea. What is the cause for diarrhea? Again, go back to the ailments. Fatty food. Yeah, good. Spoiled fish, fatty food can give rise to diarrhea. Heavy food, rich food can give rise to diarrhea. Which is the other remedy that should come to your mind with this particular statement? Diarrhea, fatty, heavy food. Pulsatilla. Pulse. Same situation, pulsatilla. Done? And we also have stools which are very frequent, offensive stools. Diarrhea, I am talking to you about diarrhea. And these stools are smelling like cadaverous smelling stools. One remedy? Good, ask. Okay. So, three things can happen here under rectum. What is it? It can be hemorrhoids, it can be diarrhea, or it can be constipation. All these things can happen in Carbo Veg. Okay. So, when a question comes up in your exams, describe the gastric symptoms of Carbo Veg. There is a method in which you will be writing. I have told you before. What is the method that you are going to follow? First thing what you are writing is, what is the first thing? You will be talking of, yes, very good. You will be talking of sphere of action only on J. Don't write lymphatics, don't write sexual and all. Time waste. Only on J you can write sphere of action. Is a beautiful remedy having an affinity for the mucous membrane of the stomach or the mucous membrane of the J, causing whatever. And then you write ailments pertaining to J only. So what are all the ailments pertaining to J? Overeating, spoiled fish, alcohol, eating fatty food, salt. Okay. So these will be the ailments. So it will be very systematic. And what could be the probable symptoms? Go from mouth till the anus. We have discussed. What all can happen in mouth? It can be a very good remedy for cancer of stomach. We missed that. It can be a remedy for ulcers of the stomach. And again you can talk of that coffee ground vomiting. We missed it. It's a hemorrhagic remedy. Okay. It can cause ulcers, it can cause cancer of stomach with coffee ground vomiting. Done? You can talk of the affinity for gas, trios of flatulent remedy. That needs to be underlined. Done? And then you end with the rectum. This is how you frame. Out of 5 you should definitely get 4 marks. That should be your aim. Clear? Now after J, one more very important area. You can see Carbo Veg having an affinity, and that system is respiratory system. Now what do you expect under respiratory system? You can answer. Very good. Asthma. Good. See, now what did I tell you? This is a remedy which has a capacity to increase oxygen carrying capacity of your blood cells. Okay. So what are the conditions that can come up? Dyspnea, difficulty in breathing, asthma, cyanosis. Very important remedy for cyanosis. When given, it improves oxygenation. Done? So you can focus on asthma. Asthma, when you have in Carbo Veg, when do you see asthma in Carbo Veg? Asthma mainly in old people, weak, debilitated people. Asthma of gastric origin. What does this statement mean? Asthma of gastric origin. Meaning after eating. See, naturally after eating there will be pressure on the diaphragm. Okay. Diaphragm is pushed up. So that can affect the breathing in Carbo Veg. Okay. Gastric asthma, which is the other remedy, a better remedy, or which is equivalent. Gastric asthma, a simple remedy. No, none of you. The remedy is Nux vomica. Gastric asthma, Nux vomica. Simple remedy. Done? So asthma, dyspnea, difficulty in breathing, okay, and you also have hoarseness. Hoarseness of voice, which mainly comes up in the evening. Hoarseness of voice, mainly in the evening. Okay. Hoarseness, other remedies? Huh? Very good. Selenium, spongia. Huh? What is it? Hepar iron triphalon. Okay. Bryonia, antimprud. The list, calcarea, phosphorus. The list goes on. Belladonna. But you should slowly also try to understand how to differentiate different remedies. When do you give belladonna? See, in belladonna, what is belladonna? Yeah, I mean, one word that should come to your mind is inflammation. Okay. So in belladonna, there will be painful hoarseness because the hoarseness will be of inflammatory origin. Okay. Done? So in belladonna, the hoarseness will be painful. Okay. So slowly, we should learn to differentiate remedies. So acting on the respiratory tract, you saw hoarseness of voice and asthma mainly in old, debilitating people, dyspnea from bloatedness. We saw that the diaphragm gets pushed up and then they feel difficulty in breathing. Gastric asthma, okay. Asthma better by eructations. Difficulty in breathing better by eructations. Cyanosis, wants fan, ear hunger. These are few things that you should remember under respiratory tract. A very deep acting remedy. Clear? Okay. See now the beauty of homeopathy is there are many remedies acting on respiratory tract. Each of them will have its own individualistic action. Okay. Like for example, from allium sipa till whatever I have done till today, Carbo Veg, there are plenty of remedies in between that you can think of. Antimtard, bryonia, natrum sulph, any phosphorus, any remedy you name, okay, they will have their own speciality. Done? Quickly, any other remedies you can think of for asthma? Calica, yes, Blata. Yeah, Blata has its own indication. We give more of mother tincture. Okay. When do you think of Calica?
Aggravation 3 to 5.
Aggravation, I will make it more simple. Aggravation 2 to 4. Calica. Cali groups. Aggravation 2 to 4. And what is the specialty of asthma in Calica? Which position they feel better? Better by bending. Bending what? No, bending head forward. Sitting erect and bending head forward. Okay, that is Calica. Okay. Done? Just sitting erect. That's more of Ashnikamal. Sitting with bending head back. Which is the remedy? Huh? No, Kali carb is forward. Forward. I am talking about bending head back. Huh? What is it? No, it's not Restox, it's not Rosara. A simple remedy. Given in Alan's keynote. I know Alan's keynote has many remedies. Yeah. So, see, each remedy will have a position. Then you should know. Each remedy will have a season. Each remedy will have a timing. Okay. And in asthma, how they behave, what they do also becomes very, very important for us. Okay. Done? So, what we are trying to tell you here is, in natrum sulph, somebody has talked about natrum sulph. What will be the indication of natrum sulph? Now the kind of weather we have in Bangalore. What is this weather? Damp weather. During damp weather, if you have asthma, one remedy is natrum sulph. One remedy. You also have dulcamara, you have antimtard, you have arenia, etc., etc. One remedy is natrum sulph. Damp weather. Okay. So what I was trying to focus here is different remedies. One condition, the indications will be different. This is what is more challenging in homeopathy. Okay, we had a patient yesterday with hypertension. 150, 110 or 120 was his diastole. Systole was 150, 160. And you know, we had a tough time cracking his case. Almost 2.5 hours my assistant doctor spent with him, and I had to spend half an hour with him, but we were not able to crack. Because you know, we were finding it difficult. He's an introverted guy. Introverted itself is a rubric, we take it, but then we were not getting what we wanted. We were having tough time. See, that's what I was trying to make you understand. For us, a case of hypertension, it is challenging because it's not like allopathy. Done? For an allopath, with due respects, I got nothing against allopathy and allopaths. They are doing their best. But what you need to understand here is, see, for an allopath, from their point of view, it's very easy. Whatever they can prescribe. But for a homeopath, we need to understand why did this gentleman get hypertension, etc. So we almost had to spend 3 hours to crack the case, and in the end we did crack. That's a different story. But what I'm trying to tell you is, no, this will be the challenge. Okay, so a case of asthma for a homeopath is challenging because we need to look at a lot of things. We just can't prescribe an inhaler which can be universal to everybody, because our remedies are individualistic and our remedies are custom made. Okay, Calica patient you can't give Naxvamica. I hope you understand. Pulsatilla patient you can't give arsenic. Or arsenic patient you can't give sulfur. A sulfur patient you can't give arsenic. You know, because there are different individuals. Now this is the challenge. So if you have to treat a patient better tomorrow, you should start preparing yourself to take up those challenges. Done? Okay? And ultimately that gentleman, we gave him Auramure. And hopefully next 15 days he will get back to us. He should be better with whatever complaints he have come to us with. Okay? So every case or every patient will have his own symptoms. So kindly take those symptoms and you start treating accordingly. Okay? So we'll look at the last part. Any questions before I take up the last part of Carbo Veg? Now what did we discuss? So that we have a continuity, you try to understand. On a broader scale, what we are trying to look at in today's class is, we are trying to look at the particular symptoms of Carbo Veg. Correct? Okay. We started with head. When I say head, 3 things should come to your mind. What are those 3 things? Hair fall, headache, eruptions. Okay, eruptions, okay. You can as well skip. But 2 very important things will be hair fall and headache. And when we saw the ear, what is it that we spoke? We spoke of mumps. What was more special in Carbo Veg? Mumps, metastasis to testes or ovaries or breast. Done. So this is how you should start. The image, the picture should start coming in. And face, what did we discuss? Generally pale, there will be cold sweat, agreed, sinus lips, and we saw epistaxis. And lower down, what we also saw was bleeding gums, pyorrhea, bad breath. Lower down, we saw stomach, weak digestion, ulcers, cancer. And because of weak digestion, a lot of things I have explained. You please, as a flow chart, you will have to remember all those things. And we saw the abdomen. One important organ we gave importance here was liver. Then we saw the entire abdomen. There can be flatulence. Simplest food can turn into gas. Okay. We saw the last area, rectum. 3 things we spoke of: hemorrhoids, diarrhea, constipation. Done. Okay. Clear? Now we are focusing on respiratory. In between we have skipped male and female. What do you expect under female? Okay. Oof rate is why? Oof rate is as a result of mumps. Can be a symptom. What else can you expect under female? Go back to the sphere of action. Okay, there can be menorrhagia, there can be DUBs, there can be metorrhagia. But what is it that you have in Carbo Veg?
Slow passage.
Yeah, very good. The lady will come and tell you, sir, the flow is not disturbing. It goes. I mean, it has been there for last 10 days, 15 days. Flow which is very slow. It's not that, gushing. one floor and my pad gets soaked. It's not the statement what the lady gives in Carbo Veg. You know, women telling, sir, one gush and the entire pad gets soaked and I have to change. That is not the scenario in Carbo Veg. Slow, one pad, full day, unless they're arsenic, they're very hygienic. Carbo Veg, it may go slow, little, nothing that is bothering them. Okay, Carbo Veg. So that is what you have under female. One more thing that you can think of in female, other than the blood, other than the bleeding, you can also expect leukorrhea, acrid leukorrhea, offensive acrid leukorrhea. And as a psychotic remedy, you can also see a lot of growths, possible. Okay, but you should have Carbo Veg, picture to match. Okay, so last thing is skin, and skin is something which is very important in Carbo Veg. Now, why is the action of skin is very important? There are few areas. As a surgery student, as a third year student, you start feeling, or you can start visualizing the cases you saw in your postings. Many cases that can be helped with Carbo Veg. What are those conditions? Okay, you can have varicose ulcers. See, varicose veins itself, first thing. Why varicose veins? Sphere of action. What was the sphere of action? Venous system, there is stasis. So there can be varicose veins. Very good. One varicose vein. Second. Very good. What type of ulcers? What type of ulcers? Ulcers which are indolent. What do you mean by indolent? Stubborn, non-healing. It's been there for last 3 years, 5 years, not healing. Non-healing ulcers. Okay. The next question that should come to your mind is, when you give Carbo Veg, what will happen? When you give Carbo Veg, what will happen? So it will improve blood flow. It will improve nutrition to the ulcer. So you slowly see granulation coming up. The ulcers, as Aishwarya was trying to tell, which are very offensive. The ulcers which smell bad. Okay? Offensive, foul smelling, ulcers, gangrene. How can you miss gangrene in Carbo Veg? Gangrene. Go back to your pathology. Understand the pathophysiology of gangrene. Okay? Necrosis. Fine? Why necrosis happen? Ischemia. Fine? Now what will Carbo Veg do? See, try to understand in the reverse. In the reverse. So Carbo Veg will improve blood flow. So ischemia goes, necrosis goes, gangrene goes. Healthy tissue happens. Now this is how you start correlating your knowledge of pathology, knowledge of surgery into material. Only then you will become strong, and you can start treating cases in a better way. Okay? So senile gangrene of fingers and toes with burning vesicles oozing bloody water. You see senile gangrene. Better remedies for gangrene or other remedies for gangrene? Sickle, very good. See, now this thing should make you think of sickle. What is the character of gangrene you have in sickle? One word. When I say what is the type of gangrene, then you should know what types of gangrene you have from your surgery. What are the types of gangrene? Dry, wet, gas. 3. Clostridium welchii is gas gangrene, if I am right. Pathology I studied long back. So dry gangrene, wet gangrene. Sickle car is a beautiful remedy for dry gangrene. Dry gangrene. Okay, sickle car. Fine? Okay. Arsenic, lacasis, Carbo Veg. These are remedies which are better indicated for wet gangrene. Okay. Sickle is very specific for dry gangrene. Okay. So dry gangrene, indolent ulcer, and one more thing you missed. As a third year student, one more very important condition that you can think of is decubitus ulcers. What is it? Pressure sores. In common language, we also call it as bed sores. I have a beautiful case of bed sores beautifully treated. I'll get you the images, pictures. Patient has given permission to share. When I do sepia, I'll start with that case. Beautiful case of a bedridden lady with huge bed sores, and you will see after our remedy how beautifully the healing happens. So that will be my entry for sepia. For that case I had given sepia, so I'll tell you why we gave sepia, what happened, and luckily I have the permission of the patient, so it will be easy for me to share it with you students. He has also given a small video how it happened, what had happened after taking homeopathy. So when I do sepia, I'll discuss that, but for time being, bed sores, you can also think of Carbo Veg. Okay? Then ulcers, varicose ulcers, ulcers which bleed very easily, pus smelling like asafoetida, ulcers which heal and break out again. These things I have taken from Dr. Fatak's Materia Medica. Okay? Ulcers, foul, burning, bleeding, varicose ulcers. These are few things you need to remember in Carbo Veg. And skin in Carbo Veg, as you all know, will be cold, okay, clammy, fine, pale, it can be cyanosed. These are few things you need to remember under skin. So the last thing will be the modalities. What aggravates and what ameliorates. See, to keep it simple, if you are looking at exam point of view, you might have a 5-mark question coming up from Carbo Veg, and the question will be gastric, which I am sure you are capable to answer. There can be 3-mark questions which might come up. One such 3-mark question is, they can ask you on skin of Carbo Veg, they can ask you mind of Carbo Veg, or they can ask you ailments of Carbo Veg. Okay, these are few 3 marks question, respiratory symptoms. They can come up for 3 marks. Okay. But you should always look beyond exams. I know your immediate requirement will be exams, but my focus is your futuristic thought, practice. And in practice, Carbo Veg is a beautiful remedy. Okay, life-saving remedy. You know that for collapse. Okay, you know it's a beautiful remedy which can give life, which can bring back life. That is the capacity of Carbo Veg. Okay, very important remedy. Done? So any quick questions, Carbo Veg? So we have done with 2 carbons. We did, 3 carbons. We did creosote, we did graphites, and we did Carbo Veg. Next class I will finish with petroleum. Again a beautiful remedy. I have some cases. I will share cases so that you understand the petroleum picture better. Okay. So next class we will be focusing on petroleum. You can as well read from source books, Kent, Clark, Boric, Allen, and keep yourself prepared so that we can have better interaction. Once I am done with petroleum, we will start with alumina followed by sepia. Sepia will be the icing, last remedy. So we will try to dedicate more time to sepia, and I will try to give you a different and a better picture of sepia. Okay? Done? Chalo.